So snoring is a very common symptom, and it's oftentimes the reason why the patient comes to see us. Up until recently, it was assumed that snoring was a normal symptom or even a symptom of restorative sleep and good sleep, but we now know, of course, that snoring is a symptom of a condition called obstructive sleep apnea, which can be quite serious. Obstructive sleep apnea is a very common condition. It affects many millions of Americans and people, of course, throughout the world. And it basically is a disorder where your airway becomes blocked at night when you go into a deep stage of sleep. Your oxygen levels drop, and your body and your brain reacts to those drops in oxygen by accelerating your heartbeat, increasing your breathing, disrupting your sleep as well. The problem is when this happens night after night after night, your body, your cardiovascular system in particular, becomes affected by it. So it can be an underlying condition of multiple problems such as high blood pressure, and then later on, heart conditions, heart attacks, even stroke, and problems with the lungs. So it can be a very severe problem, it can be a very serious condition, and when managed adequately, detected promptly, you can prevent some of those long-term sequelae as well. So obstructive sleep apnea can be treated in a number of ways, and the main treatment avenues or paradigms that we follow are from the non-invasive to the surgical. The first line of treatment for someone with obstructive sleep apnea is something called continuous positive airway pressure, also known as CPAP, which involves using a mask attached to a machine that will create a positive pressure of air that will push the airway open, keep it from collapsing, and allow for the patient to breathe in and out and have adequate oxygen levels. So that's the tried and true method and the first line of treatment, and it tends to be very effective in people that can tolerate it and keep it on and use it night after night. We advise or instruct the patient on a variety of options that are available. This might include something called oral appliances, which are devices that are worn inside the oral cavity. They will keep the airway open and allow for the exchange of air to occur by preventing the airway from collapsing. When oral appliances are not an option because maybe the sleep apnea is too severe, or maybe the patient cannot tolerate an oral appliance, or maybe the patient develops problems with their TMJ or temporal mandibular joint, or maybe even dental problems, then we explore surgical options. Oftentimes, it's a combined approach. We might perform a surgical procedure to help someone tolerate an oral appliance better, or we might perform a procedure in the nose to help someone tolerate CPAP better. So it's a multidisciplinary approach, and we have the privilege and the advantage, of course, that we work with many specialists that help us find the best course of treatment for a given patient to try to tailor the treatment individually and achieve the best possible outcome and be successful.